This is a very good question. We have moments to ask for the patient about this. The first information is that you must be trained. Just because many patients may think that you are trying to convert him for your religion. Many patients think strange, why are you asking that? And doctors, they are very busy. They need to check the cholesterol, the medications, the diabetic drugs, if you have activity, the schedule of vaccination. You have no time sometimes to ask this. And just because when you go to this part of the personality of the person, you must have time. Just because in this time the patient begins to talk. So we began making questions about this. The ACP, the American College of Physicians, proposed 5 questions. We have scales. FACIT is one scale that we use it. You ask if you have any religion, if the religion is important for you, if the religion guides your treatment. Because for us, this is the most important information. For me, there is no reason to know if you go to church or go to Muslim. No. What I want to know is a critical decision. Which are your values? In a critical decision, when I decide to death or not, which are, may I call someone to talk with you? And we made this question in the very beginning, on the admission or in the ambulatory, in the first appointment. And you reassure or recheck when you have a critical process. In cancer, for example, in oncology, you do it at admission. You do it in the beginning of treatment. You do it if the treatment fails, and you do it in the end of care of life. And you detect conflicts. Everyone in the medical team must be trained to detect the conflicts, just because the patients frequently don't tell us what they are feeling, but they tell to nursing. They tell to physiotherapists. They are better than us, much more better, to confident with the patients. And the team brings in the meeting the conflicts. And then we move to the chaplain. The chaplain tries to talk with the patient. And if the question is very, very deeply, we bring the religious representative of that patient to talk with him. It helps. In literature, there are guidelines for this, there is schemes. There was a very, very important researcher called Krystyna Prochowska. Krystyna Prochowska is from Washington. There is a page on the internet, Jewish, George Washington University. Krystyna Prochowska, Jewish. In this page, Krystyna has videos teaching you like to make a spiritual anamnesis or religion anamnesis. Which questions to ask, how to ask. There are videos explaining in the internet.